Recognizing the member for North Vancouver, Seymour.
Thank you, Madam Speaker. I would like to acknowledge that I am on the ancestral territories of the Lekwungen people, the Songhees and the Esquimalt nations. And when I'm in my riding of North Vancouver, Seymour, I work, live and learn in the territories of the Tsleil-Waututh and Squamish nations. There's been unprecedented growth in the demand for healthcare services over the past 5 years. And we recognize the importance of walk-in clinics and urgent and primary care clinics for those without a family physician, which is why our government continues to make significant investments in recruiting, retaining, and educating physicians, nurses, and other healthcare professionals to meet the needs of our healthcare system. We're taking actions in recruitment to tackle a problem that's nearly 2 decades in the making, and we are making progress in recruiting more healthcare professionals. Since 2017, BC has welcomed more than 38,000 healthcare providers to the healthcare system. In 2023, BC saw over 700 more family doctors, and over 6,000 more nurses were newly registered. More than 7,000 healthcare support workers have been hired throughout the Health Careers Access Program, known as HCAP, including over 2,000 in 2023. On June 1st of 2023, the pharmacist's scope of practice was expanded to allow them to prescribe for 21 minor ailments and contraceptives. This means that for mild minor ailments such as pink eye, simple UTIs, shingles, and more, people in BC can visit their local pharmacist to meet their care needs rather than having to go to their family physician. You can book an appointment online, over the phone, or walk into a local pharmacy. This change has made it even easier and faster for people throughout the province to access the care they need, allows the pharmacists to use their expertise, and reduces the strain on doctors' offices and clinics. Our Health Human Resources Strategy includes unprecedented expansion to medical education in BC to ensure that we are training more healthcare professionals in our province. BC has added 602 nursing seats to post-secondary institutions across the province, an increase of more than 30%. We have doubled the number of nurse practitioner seats since 2017. We have increased the number of licensed practical nursing seats by 46%. And we are expanding postgraduate or residency programs and undergraduate medical education programs across the province. To build capacity in our system and ensure that we have new generations of doctors ready to practice in BC, our government is also building a brand new medical school at Simon Fraser University in their Surrey campus, which will be the first new medical school in Western Canada in over 50 years. We are making changes that are attracting and retaining healthcare professionals across the board within our healthcare system to make it easier for patients to gain access to the care that they need. Our government has signed incredibly successful agreements with physicians, nurses, midwives, and paramedics in the past year. And with our healthcare partners, the ministry has introduced a new payment model for longitudinal family physicians in February of 2023. This model has been very successful, with thousands of physicians signing on to the model, and has already brought hundreds of more doctors into family practice. And we have recruited more nurse practitioners into our primary care system to help patients receive the care they need. We are opening more urgent and primary care clinics across the province for people to receive help with their primary care needs. And we're pleased that we've connected hundreds of thousands of people to primary care since we launched our team-based care strategy in 2018. But we also know that we have plenty more work in front of us. We know that people are struggling to find family doctors, and that's why we're making it easier for people in BC to get connected with a primary care provider. In July of 2023, our government launched the Health Connect Registry, a patient attachment system province-wide. I encourage people to register with the Health Connect Registry so we can help connect you with a provider. While it takes time to strengthen our healthcare system and to make up the nearly 2 decades of underfunding, we are making progress. We know there is more to do to support people in our healthcare system, which is why we're not stopping, and we will continue to invest in BC's public health care system, supporting patients and healthcare workers. Thank you.
Thank you.